Hi guys, my name's Laura, and I just wanted to actually tell you a little bit about myself. So I'm a podiatrist, and I actually never, up until the age of 18, that hadn't even come into my brain. I actually originally wanted to be a nurse, and I'd spent a lot of time growing up in hospital because I was a premature baby and there were a lot of complications with that. So for me, being a nurse was basically the next step. I was like, yeah, I want to give back. And the complication with that was I couldn't read till I was 13. Bit difficult, right? Didn't help that I also wear a hearing aid, and at the time it was 2 over the ear ones. Now it's a bone anchored one. And so basically there was a woman who had basically got both of her heels missing because of 2 ulcers, and so she wasn't well. But that's what got me into do podiatry. Well, actually no, it got me into do beauty, and then after several years doing beauty therapy, I was like, you know what, I actually want to do podiatry. And so I've been a podiatrist for 4.5 years. And I've been an author for the past 4.5 years as well, with Grandpa Diet and Diabetes and all with the diabetes books that I've written. And I was going to be going full steam ahead with the diabetes books, and then the 7th of February I had an abscess below my jaw. It was just here, and basically I almost died because of sepsis. And being a healthcare professional, that was really horrendous, because we deal with sepsis, we deal with infections all the time, and not recognising it was scary. In my defence, I did have really sound clinical reasoning. On the Sunday, I had gone to a nursing home and I'd seen a few patients, and one of them, she didn't need her feet doing, but she was like, "Oh Laura, it's so lovely to see you. Can I have a hug?" You can't say no to somebody, right? So I gave her a big hug. And I'm glad that I did, because that was actually the last time that I saw her when she was well. Later on that day, in the evening, about 7 o'clock, I saw her being wheeled out in an ambulance because she had sickness and diarrhea. So 2 days later, when I woke up in the morning with sickness, diarrhea and toothache, I thought, awesome, I've got toothache and I caught the bug off my patient. I hadn't realised it wasn't that, it was actually the early signs of sepsis. So I phoned the doctors and I phoned the dentists, and I was like, right, I need your advice. And they were like, well, you can't come in because you're infectious, but if it gets worse, give us a shout. And I'm like, awesome. On the Wednesday, that was on the Tuesday. On the Thursday, I wake up. I was still feeling like crap, but what was worse was the fact I had no neck, I could hardly breathe, I had immense rigour, so I was literally shaking like this. It was horrendous. I phoned the doctors at 8:30 in the morning, and one of the things that can happen is hallucinations. I heard, "We're very sorry, but the doctors are shut today due to training." I told my mum. My mum phoned. I've got you in half an hour. You would, and it was like, oh, okay then. That's not normal. Went to the doctors. The doctor was like, I'm not a mouth specialist. You need to go to the dentist. He'd taken my temperature. It wasn't quite 38.5. I think my O2 sats were low, but they weren't too low. And this is the big thing. I think he was like, I know something's wrong, but I'm going to send you to somebody who knows more about what's going on. So he gave me antibiotics, though, so I'd had amoxicillin. Went to the dentist an hour later, and within 2 minutes of being in the dentist chair, I was out. I remember turning around out in the waiting room to give them money because I needed to pay, and they all just went, no, you go now. And it was like, oh, okay then. My mum phoned my dad and was like, right, you need to get a bag. Need a phone charger, because that's a really important thing now, isn't it? Underwear and pyjamas. So the phone charger came before the clothes. And we got home. My dad then took us to A&E. And the only reason my dad took us instead of my mum actually parking up was because they are doing a whole load of work in the local hospital that we're at. So you can't park. So there was us. I was like, right, okay. There were 44 people in A&E, and we went straight in within 2 minutes. And basically, after 2 minutes of being in with triage, the Max Fax team were in there. So these are the mouth and jaw specialists. They were in with us. I'd had an x-ray 5 minutes later and with nil by mouth. 5 minutes later, I'd had a cannula and I was on a bed. So wasn't well at all and was in majors. I will say, if ever you are in A&E and you're waiting, that's good, because you're not that sick. And basically I was on IV antibiotics for 5.5 hours before I went into surgery, and also paracetamol to bring my temperature down. And they were constantly monitoring me. My O2 sats were being measured constantly because they were down to 89. My blood pressure was 60/40. My temperature was 38.5 by this point. The rigour, the whole, I feel like I'm gonna die. Or me actually thinking I'd be okay if I went now because I would be with my brother. You know, all of these different things. Weird. And having a CAT scan. And I actually have quite a funny photo of me in, not actually in surgery, but this is before I went in. Well, it's actually not. You can tell really how sick I was. But, I don't know, you can't tell. I'll put it in the posts because it's really too bright. And basically I had no neck, and that was after 5.5 hours on antibiotics. So going into surgery, I had 2 drains. You've got a scar here and I've got a scar here as well. But in order to also get the infection, they had to go down. So they had to actually take 3 teeth out as well. Learning to eat was weird because the year before I'd had a wisdom tooth taken out. So basically I've got nothing from there to there. But I would be very reluctant to actually get anything like any implants because with the fact I've had the infections, and I'm like, no. It took about 5 weeks for it to heal on the inside, but it took a good 3 months for it to heal down here after the surgery. But it was a very long recovery. I'm not really having so much physical stuff now. I do get really muscle pain and all of that. I'm very lucky like that when it comes to the post-sepsis syndrome, but it's all psychological for me. So I would have come on yesterday to chat, but I actually had my first session of CBT, and it was quite emotional because I kind of brought up some stuff, and it was like, oh, okay. But I wanted to actually say, you're not alone. If you're wanting any support, just give me a shout. I'm in the process of writing a database of different charities, like mental health charities, a whole load of different places that you can go, that if you need support, you can get that support. But what I'm also doing is this has actually triggered me to actually do a whole load of stuff with this, to do with sepsis awareness. So I'm writing an autobiographical account of sepsis from a healthcare professional's point of view, with other people as well. But doing it in layman's terms, because I don't know if you've ever read any books on sepsis, but you just want to yawn. I'm doing a CPD course for healthcare professionals so that they can recognise it better. I'm starting a health promotion campaign, and I'm starting up a website soon. If you're wanting to get involved, let me know. And yeah, nice to see you guys. Take care, and I'll see you soon.